Hello.
Hi, hello.
Hello.
And hello to everyone watching us. My name is Amber Brown, and my pronouns are she and they, and I'm the Director of Training and Community Outreach and Education for Planned Parenthood Keystone. I'm also a board member for Reading Pride Celebration. Who are you folks? Who are you fine folks?
Hi. Hi, my name is Jonathan Rodriguez. I use he and him pronouns, and I'm the Health Resource Center Coordinator and Youth Coordinator for Berks Teens Matter, an initiative of Cook County Wellness Services. And I'm also a member of the Board of Pride.
Great.
Hi, everyone. I'm Sean Brzezinski. I am currently the project coordinator at Albright College and also one of the assistant women's basketball coaches. My job is going to be changing within a week, and I'll be one of the assistant directors of admissions. I also sit on, thank you. I also sit on multiple boards, Unity within the community, also Leadership Council from the Leadership Berks, and then also, and lastly, but that's who I'm here representing, is the LGBTQ Center of Reading. So happy to be here.
I'm so happy to be here with both of you. So let's tell the audience what brings us together this evening. We know that December 1st marks World AIDS Day, which is an opportunity for us to show solidarity with the more than 38 million people in America living with HIV today. And we know that over 1 million people in the US are living with it, more than 38,000 new infections every single year. And we know that most people do not show symptoms for years after infection. So there are a large portion of people who are currently infected with HIV and don't know it. So I thought today was a fine time for us to talk about it and talk about what the resources are for folks around HIV in Berks County. So, Jonathan, I think you know a thing or two about this topic. Can you enlighten us, remind us, what is HIV and AIDS?
So, this is one of those moments that that in my mind is like, people know this, people are supposed to know this, but no, they still don't know exactly what HIV is or the difference between HIV and AIDS. So it's kind of like, okay. So HIV stands for Human Immunodeficiency Virus, and it's a virus that attacks the cells that help the body fight infection, making a person more vulnerable to other infections and diseases. Those cells are called T cells or CD4 cells. If you go to one of the clinics and you hear people talking about the CD4 cells or the T cells, they're talking about your immune system, basically. A healthy person's CD4 cells, it the count varies, but usually it's between 500 to 1200 cells per cubic millimeter of blood. That's basically one drop of blood may have from 500 to 1200 cells, that the good cells that I sometimes call it. But when that count drops below 200 and that person was diagnosed with HIV, that's when that person is diagnosed with AIDS. So AIDS is not the same as HIV, and not every single person that has HIV will get to AIDS, because AIDS, or the acquired immunodeficiency syndrome, is the later stage of HIV. It's not particularly a disease, but a combination of factors. The CD4 count falling below 200, or 2 or more opportunistic infections. So, for example, if a person with HIV is infected with has pneumonia and I always change the first name.
Kaposi sarcoma?
Yes, I always change it.
Yeah, those of us from the 80s remember that. So
Yeah.
for those people who haven't heard of it, that's like it's a very rare cancer that can cause almost purple spots. So if you ever saw that movie Philadelphia with Tom Hanks, you see that depicted.
Philadelphia, The Normal Heart, or pretty much any movie that they depict a person living with HIV, because that's like that's one of the characteristics that they always go for. But right now it's not as common actually. But it's an opportunistic disease. So if a person has two of those, that can also be create a diagnosis of AIDS. Now, for the CDC tracking purposes, a person that was diagnosed with AIDS will have it forever. But since it's a diagnosis, after the CD4 falls below 200, a person who takes care of themselves and take their medications, follow their good nutrition, make exercise, they could potentially recover a little bit that CD4 cells. So clinically, they wouldn't be accounted as a person living with AIDS. But just for the CDC, once a person gets to that stage of AIDS, they will have it forever. And of course, HIV we haven't found a cure yet, but there has been a lot of progress for treatment and to keep it under control.
There sure has. I think about, full disclosure, I'm approaching old status. I remember learning so much about HIV when I was in high school, and it was really treated as if it was the end of the world, if it was a death sentence, because it kind of was. But now things are different, which we're going to talk about a little bit today. So you were talking about some of the ways that you would know that someone has acquired or they've reached that, like, what would be an AIDS diagnosis. One of the questions I often get is, well, are there any early symptoms? Like, how would I know if I had it? The only way to know for sure if you are infected with the HIV virus is to get yourself tested.
Right.
There can be some very early symptoms in that acute phase when you're very first infected, but guess what they are? Fever, feeling achy, just feeling generally sick.
Right.
You know what else has that symptom? The flu,
Right.
COVID, I mean, there's so many things.
Right.
So most people that experience those symptoms actually just dismiss them and think that there's something else. And then they can go up to, 10 years before you're actually showing some of those symptoms that you were talking about, Jonathan. So it's the only real way to know is to get tested.
Yeah.
And
it was today. Actually, today we had this conversation that a lot of people may not want to get tested for fear of the outcome. And I think that's one of the most damaging things that a person can do, because if you don't know, you cannot take action.
Exactly. This is not a case of like no news is good news. The sooner you find out if you have HIV, the sooner that you can get on some of these great new medications that are available, which can keep you healthy like all the way till the end of your natural life expectancy. It's not like when I was a kid and you've got 15 years tops. It's different now. And so we recommend that anyone between the ages of 13 and let's say 64 get tested at least once in their lifetime, and then more frequently based on risk. And so it's my rule that if you're a sexually active person, you should get tested at least once a year, and maybe more frequently if something has changed, like partner change, or you had a condom snafu, or anything like that. What do you all think about that? Any other recommendations for testing?
No, I absolutely agree with you. When you're sexually active, you have to take all the precautions. You have no idea. Someone can tell you one thing and have something completely different. And you can trust that person with your whole heart and everything. But it's very important to know that you're being safe in every way, shape, and form. And there's no shame that anyone should ever feel about either getting tested or whether they have it, because other people have it. It's not like something that makes you like a horrible person or takes away from who you are as a person. Things like this happen. There are people who also like they have cancer and all that stuff. That doesn't make them a terrible person or like anything like that. Like, you know, it shouldn't have such a negative stigma to it, and it does, and we'll touch on that a little bit later. But it's so important to know that like when you get tested, that just means you're being safe and responsible and mature. Like that's beautiful. Like that actually honestly just like shows how mature you are as a person to know I'm gonna get tested because I'm sexually active and this is what I need to do to make sure I'm being safe and the other people I'm with know I'm safe.
Exactly.
Yeah.
When a person sometimes with teens sometimes that when we are talking about, you know, oh, the proof of love, sometimes I will bring, well, what better proof than getting tested together? You know, is being, because it's a vulnerable moment, you know, you invulnerable because a lot of people even know, even knowing that they haven't had any risk, it gets them nervous. So it's almost it's vulnerable to be in that moment. And you know, in my work, I am one of the testers, and sometimes, you know, I try to not calm, but give them, you know, a little bit of talk. You know, I never said it's gonna be fine because I just don't know. And any person that tells you before, you know, taking the test, oh, you're gonna be fine, it's like, no, they're lying, because no, they don't know. There's no to know before getting the test. So I just, you know, I just give them the options. You know, we're gonna get tested, and we're gonna, whatever the outcome, we're gonna do it together. You know, I'm gonna be here for you. Be sure to have a support system, you know, in your end. But this is the things that I can help with. So almost like a band-aid. Let's do it fast. Let's check the results, and let's get your options.
So, when you were talking, the first thing that came to my mind is when I think about the conversations I have with the staff at Planned Parenthood. One of the things I always say to our folks who do HIV testing is you want to assess your patients for how ready they are to hear their results. There are some folks that want that, like, just tell me now, I want to know so I can move on with my life. And there's other folks that when they are faced with what their results are going to be, it's terrifying, and they need like time to process it. Mm-hmm. So luckily, there are multiple ways to get tested for HIV that can cater to either need. Like, do you need time to process and think, or you're like, I want to know now. So let's talk about some of those tests, right? The original or the OG type of HIV test is a blood draw, where you'll have a trained person take a vial of blood, and it's sent to a lab for processing, and they test it there, and then they do a confirmatory test to tell you, if the results they got on the first one was legit. And I can speak about Planned Parenthood. You get your results in about a week to 10 days. How about at Cook County Wellness?
So at Cook County, we have two different tests, at least for HIV. We have the traditional, which is just like Amber said, is blood drawn, and we usually will make an appointment for the person for a week after getting tested. But you can, if you need an answer today, you can also try with the rapid test, which only takes 1 minute. That's the one that I perform. Our nurses will perform the traditional one, and it's easy, it's fast. Basically what takes more time is just getting through the paperwork to assess the risk. Mm-hmm. And it's just prick up the finger, taking your blood out, putting in a little tube, and then in a couple of solutions, and it's just like that. Yeah. Which could be beneficial for a person that wants to know today. But for other people, it's like, oh my God, the moment is coming. It's like, we're gonna get through this together. So those are the two that people can get in Cook County.
Yes. Planned Parenthood also provides the rapid HIV test. And I'm sure that, Jonathan, you'll agree with me. We don't care where you go. We just want you to go get tested.
Exactly.
There are a lot of options for places to find testing sites. This is one that I'm aware of. I've thrown the link, well, not the link, up for you all to see. This is an interactive map that you can go in and type in your zip code, and it'll show you all the places that will do testing and all the places that will do treatment, all the places that provide PEP and PrEP, which we'll talk about in a little bit. We just really want you to get yourself taken care of. So wherever you happen to be watching us, we're talking very much sort of Berks County, and for Planned Parenthood, we're about half the state, and for Cook County Wellness, you're up in Schuylkill County as well. But wherever you happen to be watching, there is a place close to you that you can get tested. We really want you to do that.
And it's just a Google search away.
Yeah. So I think it behooves us, if we're talking about testing, to also talk about how to prevent acquiring HIV. This might be another one where we feel like, well, doesn't everybody know this? But why not? Let's just make sure that we're all on the same page. So, Sean, what do you know about for HIV prevention?
You say Sean?
Yeah.
Okay, I just wasn't sure. Definitely one, which is, I think it's a big association, just not for HIV, but like any STD or anything that correlates to that, like just like safe sex is so important. It is so essential to know that, you can love someone so much, or like, it's just whatever you need to do, any compensate, yep. Any way that you can stay safe, like you need to do it, regardless of what it is in that circumstance. Because it's not just other people, it's you. Like, you want to be safe, you want to feel good with whatever decision that you make, and you want to be healthy. And those are the key components in that circumstance. So whether it's wearing a condom, being on birth control, and also, we've already touched on the importance of having whoever you are having a relationship with in any way, shape, and form, having them tested, or you being tested, or asking them if they've been tested. That's a hard question, but it's also important to know where you're at with a person. Also going to your local resources, huge, just for education value, because just because we're talking about this now and like we're fixating on the importance of like having the educational knowledge about it, doesn't mean we always have it, especially because we want to believe everyone does, but not everyone has been educated on any of this. So having these live sessions are important. Going to your resource centers, whether it be the LGBTQ Center, Planned Parenthood, Co-Wellness, like any of us. So it's just being educated and staying safe in any way, shape, or form.
So let's talk about those ways, shapes, and forms. Jonathan, what are your favorite safer sex tools?
What I actually shared it today, because today I got to perform a test. And the person said using condoms, being monogamous, and abstinence. And I said yes, absolutely, they are all valid. But this being an adult, I told them, abstinence will always be a good a good method to be safe from pregnancy, STDs, anything. But especially for adults, sometimes abstinence doesn't quite work.
It works until the moment it doesn't.
Exactly. So I always say, open communication with all your sex partners. Just be honest and not judgmental. You were active with another person, let me know, and let me take care of myself, because it's not only you taking care of yourself and me, but also allowing me to take care of myself. So that will be one of them. Also, reducing the number of sexual partners, or the numbers of partners that your partner has. Don't share needles, or just don't use drugs at all. That especially those who regard needles. use condom correctly every time you engage in sexual behaviors like being like vaginal, anal, or oral sex. If you have fissures in your gums or lips, although saliva does not carry a big load of virus,
Right.
it could be possibly for bodily fluids to enter the bloodstream through the cuts or the fissures. So have that in mind. Or just use condoms for any other sexy stuff that involves carrying bodily fluids, even if it's fingering, because a lot of people is like, oh, there's nothing here. Well, if there's bodily fluids here in your fingers and you pass it from one sex organ to another one, that's bodily fluids who are being transmitted. Don't share your toys or accessories even with your partner, and be sure to clean them and have them always in optimal conditions. And of course, get tested. Get tested alone will not prevent the infection. And I think a lot of people will use that. I get tested all the time. Yes, but it's your behaviors which could end up, getting yourself infected.
Yeah.
So, get tested, but also take action and support your own sexual health.
So I totally have to riff on some of the things because my brain was firing while you were talking. So when you were talking about using condoms correctly, let's just be clear what that means.
Mm-hmm.
Everybody needs the Magnum. Don't get a bigger condom than you need. Right? There's no need. You want to make sure that it's nice and slippery by using water-based or silicone-based lube. Please don't put anything oily on your condom. Vaseline, baby oil, hair gel, whatever you got around the house that will destroy your condom, and it's just not going to work for you. And make sure it was stored at a proper temperature. I always say if it's too hot for a baby or a puppy, it's too hot for your condom. So don't leave it in your car in the summer. When you talked about cleaning your toys, I was thinking there's really high quality, expensive toys that are made of glass or steel. You can throw those bad boys into the top layer of your dishwasher. But those sort of jiggly, fleshy feeling ones, you can't really clean those properly. So that's when it's really important to make sure you're putting condoms on them. You can clean them with soap and water, but you can't make sure all the germs are gone. Also, when we're talking about condoms, let's make sure that we're using latex unless you have an allergy, and then you would want to use plastic ones. Polyurethane, polyisoprene. The internal condoms are nitrile. They're not going to cause any allergic reaction to you. But they do still sell lambskin condoms. Don't use them. They smell funky, and they have pores in them that are big enough to block or small enough to block sperm, but not small enough to block all the antigens that could possibly cause STIs, including HIV. So
Yep.
Another safer sex tip is being in control. I don't want to wreck your party, but if you're adding substances, illicit drugs, alcohol, whatever, that can make you more likely to have riskier sex than you intended, make you oops, I forgot my condom, oops, where'd I put my phone? And it just can actually, your body's busy duking it out against, the martini. And so it's easier if your partner had something for you to acquire it from them, all things being equal.
And also, Amber, you mentioned lube. Know your lube. Silicone-based lube might be even better to use because water-based could potentially it could potentially be more effective in terms of allowing infections to happen.
Yeah.
The composition, the structure, chemical stuff. So silicone and even hybrid ones, although there's not a lot of information in terms of how well they will work preventing infections. Hybrid and silicone ones might work a little better.
That's good. Yeah, go ahead.
just reflect on the moment you said something about like being in control, how important that is. With working also in college is like being sexually active is like left and right, all around and everything like that. And sometimes we feel those pressures. It is always important to know what you're okay with, what you're not, and the importance you also emphasize on like not using substances, because that can make you subconsciously like your decisions are not where they are at when you are sober. But that's another big thing. Like you need to fixate on the importance of you being in control of the situation, what you're okay with and what you're not, because people can pressure you into stuff. And if it's something you're new to, you might feel like you need to do it because then it'll be like good for you. It's just important to know that like if you're not ready for something, do not feel like you need to do it. And that's easier said than done. But honestly, like you got to be like, you have to be okay for something else to happen, and wanting that. So, just keep that in mind as well.
Fries. Consent.
Fries. Yes. Which we could have a whole nother.
That's like a whole nother. Yeah.
We'll get to next time. So another prevention tactic that I did want to talk about is there are a lot of places in our service area, including Planned Parenthood and Cone County Wellness, but some other places as well, to access a prevention medication for HIV. So I'm going to show you a brief video to kind of introduce this topic. Maybe. There we go.
PrEP stands for pre-exposure prophylaxis. It's a daily pill you can take to help prevent HIV. Taking PrEP every day can lower your chances of getting HIV from sex by more than 90%, and it's even safer to use PrEP and condoms together. PrEP can also lower your chances of getting HIV from sharing needles by more than 70%. It's important to take PrEP every day. If you don't take it every day, it won't work as well. You also need regular checkups with your doctor while you're taking PrEP. Most people have no PrEP side effects. Some people may have side effects of PrEP, like stomach aches or not feeling hungry, but they aren't dangerous, and they usually go away after a while. PrEP is only for people who don't have HIV, but are at high risk of getting it, either through sex or IV drug use. Your doctor or nurse, like the staff at your local Planned Parenthood Health Center, can help you figure out if PrEP is a good option for you and help you get PrEP. The cost of PrEP is covered by most insurance plans, including Medicaid and Medicare. And there are other programs that can help cover PrEP's cost, whether or not you have health insurance. Ask your doctor or nurse about how to get on PrEP for low cost or free. PrEP is different than PEP, a short-term treatment that helps prevent HIV in an emergency. PrEP is meant for ongoing use by people who are at high risk for HIV. Want to learn more about PrEP or PEP? Visit PlannedParenthood.org.
All right. I hope that was helpful. I thought it was pretty succinct. So essentially, PrEP stands for pre-exposure prophylaxis. I think of it almost like birth control pills, a daily medicine that you take to prevent, but this time it's from acquiring HIV. Whereas the other medication that was talked a little bit about at the end of that video is PEP. And I think of that as like similar to the morning after pill. So if there is some sort of exposure or an accident, it's a medication you can take in that circumstance to stop HIV virus from taking hold. Now that's something that Planned Parenthood Keystone provides. Is that something that we can also refer people to Cone County Wellness?
Yes. For example, for we at Cone County, we offer PrEP for folks that are uninsured. It doesn't take much. It's just that, not having insurance and providing a letter of or a proof of income, no matter the income. But the most important part is that the person is uninsured. And we're gonna, educate them, we're gonna refer them, and we're gonna get that going.
Great. And then at Planned Parenthood, that's also something that we, like the video said, we take folks' insurance. All of our services on a sliding scale based on income. So if someone doesn't have insurance, they still need to get care. We'll do a fee assessment and take care of them that way. And then We also have, like, if people just want like a rapid HIV, they just want to walk in because I just want to know, it's a $15 thing. And for those who are uninsured, this afternoon, after we're done talking today, I'm going to be dropping off some safer sex packages up at the LGBT Center. And it includes some condoms and some info about our program, but it also includes a $5 off coupon. So you can come and get tested for even cheaper with that.
Beautiful, beautiful. Love it.
So we've spent a lot of time talking about prevention and like the facts. I think the thing that we need to wrap up our conversation today is what's actually nearest and dearest to my heart, the humanity of it. I think there's a lot of stigma still around sexually transmitted infections, and HIV in particular. And so I'd like to hear your thoughts about stigma busting, how you see it pops up in your community, our community, and what we can do to combat it.
I know one of the biggest things with the stigma of HIV is just, as I mentioned, it's really negative, and people will be discriminative, they'll be bigotry, like the list kind of goes on and on. And if someone hears that a person has it, it's almost like they are a disease in themselves. And that's what's like so ridiculous, because it shouldn't be displayed like that. Just because someone has something that, okay, it's not like the best thing in the world, but like we're handling it. We have resources for them. It's okay. And there's a community within that. There's a community for everything. And that's one of the other biggest things that we want to push is that, you're not alone in this fight. This fight is a continuous battle that people take on a daily basis. But we want to remind people, especially at the LGBTQ Center, like we have so many resources. We have different programs, different sessions where people can come. We have referrals. We have every capability of like giving you what you need in the circumstance: educational materials, resources, referrals, free counseling center, like services, which I think is also huge. That doesn't even just link to HIV, but like also thinking about the mental illness and like the mental not stability in that circumstance. But it's great that we have those opportunities for people to come and have that here, and want people to know like you're not alone in this battle. We're here. And I mean, I already kind of touched on the whole like fact that it's a negative stigma of it. And the other thing that relates with it is, gay and bisexual men, they honestly hold the highest amount of people that can be affected by HIV. And it's very disproportionated in that circumstance. And it's not just them who are like people who have it. It's not just them. It's your family, it's your friends, it's your partner. It's the list kind of goes on and on, which is why we fixate on the importance of having those resources. Because you want to educate. If you know someone who has it, you probably want to educate yourself too, so you have an understanding of what they're going through, so you can be there for them, which is one of the other big things that we fixate on. You want to educate yourself on all of that information and have an understanding, so you know what you can do to help the situation, that person, be there for them. And also, if they don't know where they can go, you can provide that for them, because it's not always easy to be like, yes, I have this, I don't know what to do, who to go to. Like the list kind of goes on in that circumstance. So with the LGBTQ Center, like I'm so happy that we're here and we're providing all these services, because Reading also doesn't have the best reputation. So like this is big for Reading as a whole. And I just love that we can all collaborate, we can reach out to each other and bounce off everyone. So
yes, so grateful for the collaboration, 100%. And I absolutely agree with you that this stigma that we see around HIV it's such a long-standing thing, and it's really, really normal to feel embarrassed or ashamed about a positive STI result, but it's not okay to just let yourself feel like dirty or like you're a bad person, because you're absolutely not. So okay, like if you take an HIV test and it comes up positive, yes, you might feel mad. You might feel embarrassed. You might feel scared or ashamed at first, but you probably will feel better as time goes on, especially if you seek help with that. So I think it's really, really important to take care of your emotional health as well as your physical health. So it's a really good idea to see a therapist or a counselor, considering that the LGBT Center is helping folks do that, like, for free. Definitely tap into that. And for those of you out there in the world who are not watching in Berks County, I would urge you to reach out to your local LGBTQ organization, and they very well may have something similar. I'm also going to say that this is not an LGBT thing. It's an everybody thing. I think that our community gets impacted the hardest, but it's not everybody, for sure.
Yeah, HIV doesn't see your sexual orientation, your sexual behaviors, your sexual behaviors to some extent, but it doesn't discriminate with the person. Everyone could be exposed to the virus depending on their behaviors, or and for example, people who are born with HIV because their parents, the parent that is carrying the baby has HIV, and maybe they didn't follow the treatment or something happened, or even breastfeeding. That's another matter of transmission. So although like Sean said, like Amber said, you might feel at that moment, you could feel alone, but you're not.
Right.
There always be someone for you, and usually, when you find that someone's, especially if you go to a clinic, it's not one, it's a group of people that are there to support you, and the LGBT center is doing an amazing work, and they only with the referrals, they do an amazing thing. But of course, that goes to not only the referrals, but everything, every single thing that they also do. So yeah, it's reach out, and also people who are negative, don't shame others, because it's a pretty feeling that a person may be going through. So there's no need to make it harder. Just need to support that person and help that person, however they want to be helped.
And remember, if you do get tested and it comes up that you do have HIV, the medicines that are available now are so much better than they used to be. We can get you to the point of undetectable.
Yes.
Undetectable is untransmissible. So if you get tested and you get on your meds and take care of yourself, you can still have a love life. You can still have a sex life. And especially if your partner then is on PrEP, you're going to be okay. Like, that's what I'm going to say. You are going to be okay. If you take care of your end of it, it's going to be okay.
Yeah. And you equals, if anyone sees you equals you, detectable equals untransmittable.
Yeah, good stuff. It's a bold new world. So I think with that, that hopeful thought, we should just wrap up by reiterating what all our respective organizations can do for the community, and share that information out for our viewers tonight and in the future. Sean, do you want to go first and tell us all about the LGBT Center?
Sure. I mean, I kind of touched on it, but just reiterating the importance of, we have the resources, whether it be counseling, referrals, educational programs, educational materials, just support groups, advocacy. The list kind of goes on and on. So we definitely feel like if you have any association that you need someone, you don't know who to reach out to, definitely do it. I can share my screen real quick. It's just the 2 pages that I feel like are really important on, I don't know, just ask me. Sure. Okay. So this is just the programs and services. hopefully everyone can see my screen, that we have. This is the website, and then this has like the slash and services. So, professional development, support, and social groups. You can click that and read more. Advocacy, referral, and then you can visit our center. This also is the location and the address. This is the other things that we do. And then this is just the resource and partnerships, which is also really important. How you can contact us. These are specific ones you can click on and get more information. Just that little tidbit, but honestly, just, a reminder that we're here. We want people to know that, like, we come in with open arms regardless of everything and anything at this point. We want everyone to feel safe. It can be hard when something like this could happen to you, and anything, honestly. But like I said, the collaboration that we hold is so essential, and it's one of the reasons why we do this. Working in a community, we want everyone to feel at home and feel like there's a family, and like I have somewhere to go to. So that's a big point that we have to share.
Thank
You're
you.
welcome.
Jonathan, you want to tell us all about Cook County Wellness?
Absolutely. Is it okay if I share my screen? Okay, it's a picture, so let me see, share screen. Okay, let me see. Okay, so I'm gonna share my entire screen, and then I'm gonna put the thingy. Okay, so whoop. At Cook County Wellness Services, we're located in 429 Walnut Street here in the city of Reading. You can make your appointment today or any day of the week except Saturdays and Sundays by calling the number 610-375-6523 or find us at cookcounty.org. We offer case management for people living with HIV with service referrals. Our team of case managers do a lot for a lot of people that are HIV positive. We provide medication and patient health education, free HIV testing, rapid as well as traditional, and STD clinic screening, PrEP for people who are uninsured, like I said, and prevention and education. We have the HIV navigation services. This is like it's a program for people who may be at higher risk but are negative. This program basically allow us to help everyone. Oh my God, I'm sharing a bunch of stuff here. Okay, that program allows everyone to pretty much not keeping track, but allows everyone to make the changes or the modifications in their life to lower the risk. And although it's not specifically for people who are HIV positive or negative, but it's basically for everyone who's a teen from the ages 13 to 19. There's the HRC, which is a safe place to come and ask questions and talk to a person that will not judge you, and maybe you can both learn together about anatomy, about sex ed. And that's why I have this page open, because that's where you can find the Health Resource Center. Oh, and you're going to be talking to me, so I'm the person. You can either scan that code or just go to the to Zoom and put the information that is right here. It's open from Tuesday to Friday, and the hours are here. Or you can also text or call this number, and you're gonna find me.
Thank you. And then I'm going to give you my little spiel. So I will learn to share my screen as well. All right. Here we go. So I think most folks are familiar with Planned Parenthood. This is our local website, and you can head here to make online appointments. We are providing all of the same care that we always have, including life-saving cancer screenings, birth control methods, STI testing and treatment, well person exams, PEP and PrEP, all kinds of sexual health care needs. But now we can either do telehealth, or we can do a hybrid visit, which will let you do part of your visit on the phone and then only come in for like a little bit of in-person contact. And another thing that I wanted to share is that, let me zoom in if I can. I can't really. So Planned Parenthood Keystone also has a health resource center where you can get free condoms and conversation with a sex educator that is completely confidential and completely judgment-free. So this is open, much like the one Jonathan talked about, to any young people ages 13 to 19. So at Planned Parenthood, you can come and make this part of your visit with us, or this can be your whole visit. You can come in and check us out. We're also available to do kind of one-on-one video chats too, and you can find that information at the link that you see scrolling at the bottom. We have a link tree that will tell you how to get there. All right, I think that we have talked this topic all the way down, and I so appreciate us having this conversation. And I want to honor, that it is World AIDS Day, and that's when we bring it up. But it's near and dear to our heart always. We're going to keep talking about it with each other and with our patients and with our community until we can make it, a thing of the past. Yeah. Any closing thoughts, my friends?
Sean, do you want to go?
Sure. My closing thoughts are just, I'm glad that we had this conversation. It's very important to be able to have tough conversations, whatever topic it is, because the more you can educate, the more educated you become, and also realizing that there are resources, there are people I can talk to, and you also feed into the fact that you reach so many different communities and so many different people. So I'm just glad that I could be a part of it. Thank you. I'm very honored. And I hope people had learned some information or also will reach out to our services.
Yeah. Jonathan?
I do want to echo Sean in terms of, thank you so much for opening this space to talk in this platform. And, it's always, I love having the difficult conversations. And that's why I work where I work. So please keep the conversation going, even if it's difficult, even if you haven't, if you're a parent and you need to have this conversation with your kid, if you're not a parent but you are, the adult around a teen, or if you're a teen and want to have this conversation with another with a peer or with an adult, just have the conversation in an open, honest, and free of judgment space, because the conversations will destroy the stigma, and we need to live stigma-free and hopefully, eventually, HIV free. So keep the conversation going.
Thank you both for joining us, and remember that all of us care no matter what. And if you need help around this or any other sexual health need, let us know. Stay safe, everyone.
Bye.
Bye, everyone.